Hello, I'm Patricia Bentkowski, Duville nursing student, 240, dressing change, sterility. First, what I want to tell you is that unfortunately yesterday a lot of my wrappers that I had, like my ABD pad and my gloves and my sterile field, got thrown out. So I'm having to improvise, but I will let you know as I'm going along that I know that it's sterile and I'm going to go through the process. So before I get started, I've been in my patient's chart. I've double checked the orders, and it says dry wound dressing change every 24 hours. So that's what I'm going to do. So I'm going to gather my supplies and bring them in the room. I've brought them in the room. Knock, knock. Hello, Mr. Smith. I'm Trish. I'm your nurse. I'm going to do your dry dressing change today. Are you feeling okay? Any pain? Any tenderness? Nope. Okay. And before I also start, I'm going to be using latex gloves. Do you have any allergies to latex? That would be like as if you ate shrimp, some kind of shellfish, lobster, crab, and you had a reaction. No? Good. Okay. Okay, Mr. Smith, and just one last thing I'm going to go ahead and wash my hands before we get started. Could you verify your full name and your date of birth for me? And I'm verifying this against his wristband. All right. I'm going to get a pair of gloves, just clean gloves because I'm just removing the old bandage. And I've made sure his bed is at working height. I've lowered the bedside rail. I've moved the trash can. And I can look at the ABD and I see that the it was dated yesterday. It was changed yesterday, so it's good. So now just let me know if you feel any discomfort. I'm going to lift it up and I am going to assess it using a Rita. Area, redness, edema, ecchymosis, drainage, and approximation. And there's no redness, there's no ecchymosis, no edema, no drainage, and it's approximated. There's no dehiscence. So I will take this and dispose of it. Okay, so now what I'm going to do is I'm going to get everything ready. This is going to be a sterile procedure, so I have to get my things in order. I'm going to take off my gloves, throw them in the garbage, and again I'm going to wash my hands. This table has been sanitized. I have washed it down with a wipe. I'm going to put my barrier for my tape right at the edge here of my table. And then I'm going to take 3 more pieces of the ABD pad. And on one I'm going to write my initials, the date, and the time. Okay. have got my sterile water, and I have verified that it's not expired. Seal's not broken. It's not cloudy. I see no particles floating around in it. Here's my sterile cup. I'm going to take the lid off of it. And set the water there. Now I'm going to do my sterile field. So this is my sterile field package. I am going to open it away from me. I'm going to pick it up by one corner, keep it up above. Let's just get rid of this. I'm going to open it up. There's a 1-inch border all the way around. I'm going to keep it up, not to go below my waist. And the part that I'm talking against, I'm going to put on the bottom underneath. So I have a 1-inch border going all the way around. Now I'm going to go ahead and put my sterile saline in here. I can never turn my back on the sterile field. My sterile, my 1-inch border. I will get my ABDs, my 4x4s, and my gloves. Again, to make sure nothing touches the sterile field. This is going to be my ABD pad. So I'm going to open it with my dominant hand. I'm going to grasp it, and I'm going to right in the middle of the field. Drop. My hand may have gone below my waist, but if it did go below my waist, when I dropped it, my hand went down there, I'd have to start it all over again. So once again, I can go all the way around. I can't cross my sterile field. Now, here are my 4x4s. Same thing. I'm pulling it away using my dominant hand. I'm dropping it. Okay, that fell. That fell in the garbage, so I'd have to start it again. So let's go back and say that didn't happen. I'm dropping it. Garbage. And I need 3, so I have to open up one more package. Once again, garbage. Now, the last thing I'm going to do is put on my sterile gloves. I have to make sure it does not touch my 1-inch border. So I'm going to pinch the cuff. And put my glove on. And then using the scoop method, I'm going to get my other one. keeping my thumb up, and always being conscious that I did not go over my barrier. Then once I get this glove on, I can adjust this glove. And I can knock this off with my elbow, as long as I did not cross the 1-inch barrier. So what I'm going to do first is I'm going to take my 4x4s one at a time and clean the wound. I'm going over, folding up, around my barrier, back around, don't go below the waist. I'm going to go down the middle, garbage. I'll take my other one, fold it up, around my sterile field, come back around, and clean the outer side. And drop it. Then I will take a third one, my sterile water, go around my sterile field, do the outside, the closest to me last. Okay, so now the next thing is we get the ABD pad. Blue side line facing up. Put it over the wound. At this point, sterility is complete. They're not sterile anymore because there's the pad is on top. So now I need to get my tape. You can take your gloves off at that point, which I recommend. Otherwise, the tape sticks. And I don't have to worry about my sterile field now. So now I'm going to go ahead and take off my gloves. The proper way is to pinch. And then take 1 or 2 fingers from underneath, pull it over, garbage. I don't know what happened. I had a piece of tape with the time and stuff on it. So I'll put my initials, time, and date. Okay. So now I would ask the patient, how was that, Mr. Smith? Any discomfort? Do you feel better? Okay. So I will cover him up, lower the bed, put the bed rail up, make sure call bell is in reach. And then I will clean up my area. Wash my hands. And then the final thing I will do is I will document in the MAR, in the patient's notes, patient tolerated dressing change. and with the ureta area, um, redness, edema, ecchymosis, drainage, approximation. I'll note all that in there, and uh, and then I will check back on my patient later unless he needs something. Okay, Mr. Smith, I'll see you later. Thank you.